The biomechanical principles behind authentic movement patterns are consistent regardless of whether or not the subject is trying to acquire absent patterns or improve quality and performance in existing movement. So much so that the principles behind the model being presented here were first developed during my military service with 2-3 SAS when remodelling the training regime that prepared candidates attempting the physical selection course for entry into the regiment. Failure rate due to injury was extreme. However, using the model to improve movement quality virtually eliminated dropout due to non-traumatic injury. I continued to develop the methodology after leaving the military. In May 2017, I lost all movement skills as a result of a hemorrhagic brainstem stroke and 10.5 hours of resultant brain surgery. The model was used to regain my movement and derive neuroplasticity for a recovery that the neurosurgeon in question described as amazing and contrary to conventional wisdom. The model has successfully rehabbed patients who were up to 6 years post-event and for whom a conventional approach had not restored authentic movement and had ceased to provide any further improvement. Movement patterns are hierarchical. New movement skills are the result of first establishing the most primitive pattern, layering subsequent primitive patterns on top, and then culminating in a complex skill. Movement rehabilitation in brain injury patients frequently has poor outcomes because the first aspirant skill attempted is walking. This is equivalent to wanting to construct a 10-story building and starting with the 6th floor. The neural development sequence has already been successful with every single able-bodied person on the planet. For the brain injury patient to successfully follow the model, the therapist must first ensure requisite mobility and, rather than movement instructions being made cognitively, ensure the naturally self-limiting scenario of neurology only being able to select options from what the existing skill set has brought to the edge of ability.